Hello, we are MoZaic Care. We are located in San Francisco. We are 100% focused on gender affirmation surgeries and gender nonconforming affirmation surgeries that are strictly below the pelt. Our background we are pelvic reconstructive surgeons that have historically been trained as gynecologists, have subspecialized in pelvic reconstructive surgery, and had additional training in reconstructive plastics and reconstructive urology.
The founder and director of our clinic, who you just heard from, is Dr. Heidi Wittenberg. She has worked in San Francisco for over 20 years as a pelvic reconstructive surgeon. She is currently the medical director of the Gender Institute at St. Francis Memorial Hospital and the co-director and founding surgeon for the Center of Excellence for Gender Confirmation Surgery at the Greenbrae Surgery Center. Team MoZaic is a tight-knit group that is dedicated to caring for transgender and gender nonconforming patients, where the front and back office staff are all integrated into a cohesive unit. Our providers include Dr. Heidi Wittenberg, who you already met, our physician assistant, Megan McCaleb, and myself, Dr. Adam Bonington. We are all committed to making sure the care we provide is the best it can be for our patients. We offer transfeminine, transmasculine, and gender-expansive surgical options for our patients. We will start by talking about the transfeminine surgical options. For creating a vagina, there are 3 different options. The penile inversion technique is the most common technique and uses skin from the penis and scrotum to line the new vagina. The peritoneal pull-through option is a GYN procedure that is now being used for gender-affirming vaginoplasty. This procedure uses a lining from the abdomen called peritoneum to line the new vagina. These are the 2 vaginoplasty options offered at our clinic. The third option is a colon vaginoplasty, and for patients interested in this surgery, we would refer to a surgeon who performs this particular procedure. For patients on the transmasculine spectrum assigned a female sex at birth, we offer gender-affirming hysterectomy with removal of the uterus and fallopian tubes, and potentially the ovaries based on patients' age and individual characteristics. We also offer the options of full or partial metiodioplasty, tailored to the patient's individual goals and needs. Prior to performing hysterectomy or any of the procedures that result in surgical sterilization, it is important that patients talk to their primary doctors ahead of time about their fertility preservation options. When considering removal of one or both ovaries, we also recommend they talk with their hormone specialist or primary care provider about the potential implications to their long-term health. We will discuss with patients their minimally invasive surgical options for removing their internal organs, including laparoscopic or potentially robotic techniques. For patients who identify as nonconforming, non-binary, gender-expansive, or intersex, we have developed some individualized procedures based on patients' unique goals and desires. Options have included metiodioplasty with preservation of the vagina, and also vaginoplasty with preservation of the penis. After the operation, each patient's experience with healing and recuperation can be different. For the bigger surgeries like metiodioplasty or vaginoplasty, it is a 12-week initial recuperation off of work, and it can take up to a year to see final results due to nerve healing and swelling. Most importantly, we want patients to feel that they are empowered to make a decision about surgery that is right for them. This involves doing research on surgical options and surgeons ahead of time, asking a lot of questions, and not hesitating to have more than one consultation. We want our patients to know that you are in control, you have a choice, and you deserve the best care possible. Thank you so much for listening to our presentation. We want to thank Gender Bands for inviting us to speak, and we wish everyone a happy Utah Pride. If you need us, we would be happy to have a consult with you. It would be our honor to take care of you. Our clinic is based in San Francisco, California, and our best contact information can be found on our website at mozaiccare.com. We are also on Instagram at mosaic_care. Take care, be happy, healthy, and safe.